I'm Pacovia Lovett. I am the state school social work consultant at the Department of Public Instruction. I have been here, I think, a little over 6 years, maybe almost, yeah, something like that. And prior to that, I spent 14 years in the field as a school social worker, primarily in the Piedmont Triad areas, and a lot of time in Randolph County. Um, so that is my background, and we will be talking about evaluating SIFS roles, which is specialized instructional support. You'll hear us say SIFS a lot in this session. Um, and so I have my colleagues and partners here, and they will introduce themselves before we get moving.
Good morning. I'm Keisha Bryan. I am the school counseling consultant here at the North Carolina Department of Public Instruction, going into my 5th year. Excited to be here. Before coming to NCDPI, I spent 20 years as a school counselor, primarily in Wake County, and a brief stint in New Hanover County, and love all things related to school counseling. So excited to be here and to share about on this topic. And I'm going to pass it over to my colleague, Megan.
Good morning. I'm Megan Carden. I'm the school psychology consultant at DPI, and I've been in this role for about 3 years. Prior to coming to DPI, I was a school psychologist for 19 years, and most of that, the last 14, was in Nash County schools, and I was the lead school psychologist, and I did a lot of school psychology NESIS evaluations. So I'm excited to be able to talk more about that today.
Awesome. And we have some partners on with us today as well. It's going to talk about different sections as we move through.
Good morning, everybody. My name is Jennifer Bass. I am the NESIS consultant here at DPI, and I am so thankful to these ladies for joining us because I have been getting requests for years asking about these instructional support personnel rubrics and how to best observe and evaluate them. So I do thank you all three for joining with me to offer this to the field. So if you are on with us today and you would like to receive NESIS credit, you are able to get leadership or general credit for this course if you stay the whole time. So if you would like to register NESIS, click right there or click in the link that I have put over in the chat and you can register. After the end of this, Donna Curry and I will be taking roll in attendance and we'll be awarding credit for those folks who attended with us today. So you can find, after we award credit, you can go into your NESIS and you can find the course registration sheet and the certificate that you can take to your PSU to get credit for this. So thank you.
Awesome. All right, so we're going to get into the meat of all this. And so we are going to go off camera just to preserve some of the bandwidth, but we'll come back on a little later to answer questions. And also feel free to use the chat. We'll have some interactive thought questions along the way. So feel free to interact that way. We definitely want this to be an interactive session. We want you to get what you need out of it. So feel free to ask questions along the way as well. All right. This is kind of our team. We're part of the Healthy Schools team here at DPI. And what that means is basically we are a lot of the non-academic content areas, and we just have a mission and vision and how we do it that's established. I do want to point out the whole school, whole community, whole child framework, because that is something that the state board has prioritized as being a way forward for schools and thinking about health as it relates to the whole child and everything that interacts and impacts the whole child. So you should, I hope that's not the first time that you've seen that, but if it is, definitely reach back out to us because we have additional resources on the WIS framework and some posters and lots of things that will help your districts along the way. We also like to show our team, the Healthy Schools team here. And you may interact with different people in different ways. Of course, we are all there. Our chief is Dr. Ellen Essick, And then you have some other folks, some of you that do Title V or reproductive health or get the feminine hygiene grants. You'll see Lillian Pinto there. Some of you that interact with shacks or lead shacks or part of shacks. Suzanne Small is there, and she coordinates a lot of the shack work. Project Aware Director, Dr. Heidi Austin is also with us. We also have school nurses as a partner with us. They are housed or based at DHHS, but we, of course, work very closely with Jennifer Corso and the school nurses. And so that's our team. Feel free to ask questions about any of those folks towards the end. We're happy to make connections if you need it. And so then thinking about this training and why this training, I think Jennifer said that there's always requests for different parts of this training and what it looks like and what options are and all the things, because it's very different. We don't always fit neatly into the traditional classroom model for observations and doing the uh, evaluation process. And so, because all of these roles are different, they require a different lens to evaluate. And so, um, when you think about it as only in classroom instruction, you miss some of the high quality practice that these individuals in particular offer. And so today we really just want to think about that lens and ensure that evidence is interpreted in a way that makes it fair across these roles in particular. Thinking about how the impact, what happens when these individuals do their job, what the impact is. While this is a shared process, evidence look very different. Our evaluations look very similar, and we have a lot of shared processes. But our evidence will look very different across these roles. And then that calibration. And I think no matter how familiar you are with these roles, these evaluations, these evidences and artifacts, the calibration is always something that can be refreshed. Um, and so thinking about that in terms of the goals for today, these are intentionally kind of evaluator facing because we want, again, for you to get what you need out of here. We're not going to, it's not retraining on these standards. The standards didn't change. They are the same. But we do want to help evaluators look at the standards with more precision and especially more confidence. And so we want you to be able to kind of know the evaluation cycle, the rubric language, identifying key words throughout that language, distinguishing evidence that is role specific, and then identifying artifacts that show impact more so than just activity. And so thinking about that, your challenges have likely all been around what artifacts to accept, how to rate the evidence, and how to give meaningful feedback. And all of those things we are going to address because we realize that those are the most common challenges. So taking a moment and in the chat, just kind of put a number in there. Of course, there's no wrong number, but how confident do you feel evaluating SIS roles? And this is very confident, somewhat confident, still learning, or I need more clarity. And we expect that there's a mixed bag. But we definitely just kind of want to see as we move through the next sections, it will help us determine how deep of details we might need to go into moving in. So let's just see some of those numbers. Oh, okay. Awesome. Yeah. A mixed bag, as we expected. Good. I'm actually really excited to see the ones, because that means you are definitely in the right spot. Cool, too. Okay. All right. Wonderful. And so now that we kind of know where you all are starting, we're going to ground ourselves in some of the current evaluation policy and cycle options.
All right, and I'm going to take over here because we have some big news concerning Eval 004, the school board policy. It was updated on July the 9th of 26, so just recently. This has been a process that has taken us 2 years at DPI to get these changes made. So if you'll go to the very next slide for me. The biggest thing that happened with our new Eval 004 is that we have titled it North Carolina Educator Evaluation Process, which means it used to just pertain to teachers. And now we have included all of the instructional support personnel within the policy itself. All of the changes that were made were effective immediately. But we do want you to know that all of the changes that we did make to policy eval 004 were in response to LEA feedback. And we realized we needed to clarify those evaluation expectations for everyone in the field for all educator roles. And we needed to make sure that we were aligned with current statute and administrative code in our state. So I'm going to go over with you just a little bit about what these changes actually mean for people who are in these specialized instructional support roles. As I said before, now all of these roles are included in policy eval 004, where before they all had their own policies and they didn't fall within the evaluation policy that teachers followed. So now the biggest changes is any person who is a specialized instructional support personnel with 3 or more consecutive years of employment with their local board are eligible to be assigned to an abbreviated evaluation plan. In the past, that was only available to teachers. Now, all of our support personnel have the option, if they're eligible, to be placed on the abbreviated evaluation plan, which is a big win. We have been asked for that for years, and now we have made that happen. As you guys know, if you are familiar with the teacher plan, that abbreviated plan is going to require only 2 observations throughout the year. That would be a minimum of 20 minutes of the observation time in your role. And we're also only going to look at 2 standards rather than 5. So the abbreviated plans that we're going to observe for the roles that are here today, the school counselor and the school social worker, during the abbreviated observation, we'll be looking at standards 1 and standards 3. And for the school psychologist role, we'll be looking at standards 1 and 2. The standards that were chosen to be included in your abbreviated observation were chosen by a group led by your consultants in your area, and they went out, they really looked at those standards, and they collected data, they collected feedback to decide which 2 standards were the best ones to gather as much information about your practice in your role. So that Jennifer Bass did not decide that. That was decided by your peers and your consultant. So standards 1 and 3 for counselor and social worker, and 1 and 2 for school psychologists. Also in this policy reboot, if you were hired with less than 120 days in your contract year, you can be placed on the late hire plan. And I will look at the graph in just a minute, and we'll kind of go over what is required for each one of these plans so that everybody's very clear. As you note, at the bottom of the 2 slides, I have resources here. So all of these new updated charts and resources are there for you to take a look at, so you don't have to go searching for them. But if you would like to look at them on the NCDPI website, they are also found there, along with each one of your bubbles that represent your role. So let's talk a little bit about what the evaluation cycle requirements are. As you can see, the components are down the left side, and they include the training, orientation, and the teacher self-assessment and professional development plans. All of our roles will take care of that. And then the observations that are required for each one of the plans is located under the component. But as you can see across the top, these are the 4 types of cycles that can be assigned to teachers and any of our specialized instructional support personnel. The first is comprehensive. Any person who has been employed less than 3 years by a local board will have to be placed on the comprehensive plan, and that would include 3 formal observations by the principal or their designee and 1 by a peer, and then the summative form at the end. If you have been employed more than 3 years by your local board, you can be placed on the standard plan, which would include 3 observations and the summative. Usually, if you are in the year that teachers, if they're in the year that they are renewing their license, they would be placed on standard. Now, this is our big win for all of our instructional support folks. The abbreviated is now available to you. You are eligible if you have been employed for 3 or more consecutive years with the local board. And as I said, that would include 2 observations where you're just looking at 2 of your standards and then your summative. And if you are, the late hire plan has been put into policy. If you're hired with less than 120 days of an employment contract in a year, that would include you do the training and orientation. You would have 1 formal observation, does not require a PDP as the other plans do, and then you would complete your summative. So those are the 4 cycle types that are now available to all of our educators in North Carolina, thanks to the new updates to Policy Eval 004. And this is just some clarification that goes along with that table, and I've pretty much already gone through that with you, but it is there for your information. Do know that more observations than the required can be conducted for any evaluation type. If the supervisor thinks that maybe you need a little more feedback or a little more support, they could add in some observations, but that is at their discretion. And as I said before, it is recommended that you look at all 5 standards if you are in your license renewal year. And that's more so for the teachers. But the NCDPI evaluation cycle option, this is just another for your information, and I did link it earlier on some of the bottom of the slides. It just tells you, based on your employment term, what type of cycle your principal may choose to assign you to. So you would have to look at that and decide where that person would fall based on how many years they've been employed, if they are a beginning employee or anything like that. But that would just kind of help you to lay out who needs to be placed on what cycle type. And I'm going to turn it back over to my ladies. Thank you.
So now we're going to get into evaluating our SIS roles for school social workers, school counselors, school psychologists. Next slide, please. And so when you look at our for evaluating our roles, if you'll go back a slide, Pacovia, remember that this is evaluator facing. So when you are looking and observing your SIS staff, instead of asking, what did I see during this observation? Because one of the misconceptions is that we're not evaluated like teachers. So our roles are very different. And so instead of asking, what did I see? We will really want you to look for the body of evidence as it pertains and is very specific to that role practice, that professional judgment, and what is the impact that our roles are having on students and systems. Also, what are the artifacts that directly align with the rubric language for the different standards that you see that demonstrate the impact on outcomes for school counselors, for school social workers, and school psychologists? Data, what is our professional, what did they learn, and what is the feedback that makes our ratings more defensible as SIS individuals? So as Jennifer has already explained, there are different types of evaluation cycles. Comprehensive, again, once you have already learned it, they are typically used for beginning to new to role professionals, and for that who have been employed less than 3 years by a local board. And that involves observations, conferences, PDPs, summary ratings, and this can be looked best from a broad lens over time. It's not a single event, but you're looking at what are they doing over time. Then there's the standard cycle that's used for eligible experienced professionals according to the LEA timelines and policy, and they require evidence roles based on the role standards and meaningful observations. And in these roles, again, you should be looking at data, you should be looking at impact and outcomes. For these specific roles. And we are excited about the new abbreviated opportunities for those individuals that have been employed 3 years or longer. As you can see, again, for school counselors and school social workers, our standards based on the feedback that we've received from the field was chosen of standards 1 and 3. And for school psychologists, the abbreviated cycle is for standards 1 and 2. And just because they are abbreviated doesn't mean that it is lessening of the work, but it gives opportunity for deeper observation and really time to look at the work on a greater and deeper and more in-depth lens with the abbreviated cycle. So as you're looking at the rubric, as an evaluator, rather than just going in and just observing, we really want you to pay attention to what are the verbs that the standard is asking and highlighting. So verbs like collaborates, analyzes, develops, implements, evaluates, advocates, communicates, consults, and adapts. So when you look at the verbs really help to show what is the specific practice that is taking place, and what the practice should look like. It really identifies for that particular role what is being asked, and then finally, what is the impact. So when we look at objects, ask what is the action that is actually happening directed towards students, families, school staff. Data is a big word because we are not just mindlessly doing work as SIFs individuals. We are doing data informed work that informs our programming and our service delivery that impacts policy and also impacts systems. And when we talk about impact, that goes to what are the outcomes that you see as a result of the work that these individuals are doing. Determine what changed, what access changed, what engagement changed, what was the impact on attendance, safety, mental health, support, problem solving, academic progress, and achievement when you go in and you are looking at the rubric and the evaluation through these 3 lenses. So verbs, objects, and outcomes.
So the rating language for each element or standards item includes developing, which is growing towards competence. It might demonstrate that that person needs additional support, needs to kind of to show that those skills more consistently, or it may just mean that more evidence is needed to really demonstrate where that person is with those skills. Proficient is that basic competence. Your practice is aligning with your expectations. Accomplished means that you're exceeding basic competence most of the time. You're consistently demonstrating that particular standard or element, and you're showing some effectiveness. And distinguished means that you're consistently and significantly exceeding expectations. So your evidence is going to show leadership beyond just like your assigned school and contribution to systems. It's going to be really kind of top tier rating and skill development. So one thing to remember when we're doing these item ratings is, first of all, this isn't based on how busy someone is or how much that evaluator appreciates that person. We're really looking at the rating anchored in those rubric descriptors, and the scoring is cumulative. And Pacovia, if you could go back to the last slide, thank you. So in order to be rated at a higher level, all the evidence needs to be documented in those lower level practices as well. So if we're going to rate someone at accomplished, we need to have evidence documenting that they've met those items under developing and proficient, as well as under accomplished. And sometimes it's going to be there's some present in each one, and not completely demonstrating in each of those levels of rating. But we definitely need to make sure that we're demonstrating the evidence in those lower level practices as well as the higher level practices. And I think this can be challenging for CISP staff who haven't had an opportunity to engage in a comprehensive role. And of course, I'm taking a school psychologist lens where I think about a lot of school psychologists who end up having a really assessment heavy role in their district, and they may not have had the opportunities that they would need to have to demonstrate higher ratings in some of those areas that go outside of the assessment and eligibility role. And so sometimes even very experienced staff could be rated at developing or proficient on some of the items. And just keeping in mind that the purpose of the evaluation is partly to define the role and also to identify ways to continue to grow and become more proficient at our jobs and at our roles. So we do have common standards across the three CISP role areas: school psych, school social workers, school counselors. Our standards are standard 1 for all of us includes leadership, systems advocacy, collaboration, program direction, fostering a respectful environment, which is focused around building equity, inclusion, student dignity, family engagement, professional practice, which is really those specialized services that are unique to the role. This is where you're going to see the most kind of distinction between our 3 different role areas. The leadership can also look different based on the role. So, for example, leadership for a school social worker might mean that they're leading attendance or family engagement systems. Leadership for a counselor may be comprehensive school counseling program implementation. And a school psychologist may lead MTSS problem solving or data evaluation teams. We all have supporting student learning, removing barriers and improving access to learning, as well as reflecting on our practice. So looking at data, looking at how we can grow, how we can adjust to changing needs within our schools and communities, and just kind of continuously improving our practice and responding to the needs of our students and staff. So thinking about the artifacts that we're looking at when we're doing these evaluations, and thinking about what makes that evidence strong. So you can ask for artifact explanations, having conversations with the CISP staff member who you're evaluating. It's a really great opportunity for you to have some conversations and learn more about what they're doing. But so if they're giving you artifacts, a document alone might not be enough to really detail what they've been doing and how they might be meeting a particular standard. So for example, if a CISP staff member led a family night and they gave you a flyer to document that activity, all by itself, it might not give enough context, it might not give enough data, and it might not really connect very well to the rubric language. So the more that can be aligned and explained, it gets a lot stronger. So asking about the reason for the event, documenting what was the research or the data or the evidence-based practices that were used to plan content for the event, collecting attendance data, collecting feedback from families who attended, any sort of follow-up steps, and maybe what were some outcomes, what changed in family engagement or student support for that particular family night. All of that context, the data, additional support is just going to make that artifact evidence stronger and stronger for an effective and accurate rating. And then, of course, we want to have some feedback questions and have some conversations. So whether we've done an observation or we've evaluated, an artifact, asking some more questions, both to follow up and get more information, and then also to kind of have that staff member reflect. So asking some questions in a post-observation conference, summary conference, artifact review, keeping the discussion grounded in evidence and professional reflection, rather than just sort of impression. So what data prompted this work? What standard or rubric element does this evidence support? What skill or decision making is being demonstrated here? How did you collaborate with students or families or staff or community partners? What changed or what were outcomes for students, families, staff, or for the system? And what would you keep, stop, or adjust next time? Those are some really good kind of starter questions to have a rich conversation around artifacts and around some of those different standards ratings. Okay, so now before we, this one's Macovia's. Go ahead.
All good. You could have went with it.
No.
We will think about this. We'll pause here for a second and sound off about what artifact you've seen that helped you better understand SIF's work. And it's okay to say, I'm not sure that I've seen one yet. But based on kind of the things that you've just heard from Megan, and then just kind of your experience as an evaluator, what has been one artifact that you feel like helped you really understand what that person did? If you have examples, just put those in the chat and let's just see some of those. Or any explanations or why something helpful or what you wished you would see. Maybe, maybe not. Okay, we'll move. We'll keep it moving here into this kind of first standard in leadership. We'll take a moment here and break down.
Oh, Pacovia,
Okay,
we're getting some feedback now.
Okay, maybe
If
I
we
moved
wanna
too
pause
fast. My
and go
pause
back.
time was not great. My apologies. Okay. Um, oh, a calendar with visible docs and trackers. That's a good idea. Going on home visits. I love that. I love that. I love that. Yeah, school counseling plan template from ASCA. Progress monitoring docs. Oh, yes. I think we mentioned that somewhere later. Cool. All right, all good things. Perfect. I knew y'all were gonna pull through. Here we go. Thinking about leadership, and so the next few slides will be this way, and they're set up this way on purpose so that you can kind of see what keywords to look for, what good artifacts are, and then questions. And please don't be afraid to ask these professionals questions. Question what they're doing. And we're going to have some of these same conversations with them to let them know that they should expect to be questioned about some of the things that they are doing and why they're doing them and what indicated the need to do them. So you can see here that leadership, this is really not just about, being the head of a committee or having a formal title. This is really about how professionals lead with data, how they might clarify protocols, influence teams or student groups or systems, or respond to a need effectively, or respond to a crisis effectively. Those are all things that fall in the realm of leadership with these particular professionals. And I think that any of you who've had these professionals that are essential on your campuses realize their leadership, especially when it comes to crisis, because we all are trained in a certain level of crisis intervention and really thrive in those crisis spaces. So that's definitely a form of leadership. Also thinking about and asking questions about some of the other things they're involved in, because there's many of you who have these professionals who serve on different work groups that are more macro level. Some of them are on our teams where they help us think through some of these different tasks and parts of service delivery. And then some of them are in community teams where they are able to show their leadership and do different parts of the work. So really asking those questions too about what else they're involved in that extends beyond kind of the walls of your campuses and school communities. And then really those feedback questions. About around influence in particular, like looking at that, what influence did you make? How did you lead or influence something one way or another? And then how did that align to the school improvement plan? We are going to be telling these staff to make sure that what they are doing aligns, and I feel like they do a decent job at that. But that's also a question to ask, because they should be aligning their priorities and workloads based off of what those school improvement plans are. And then what changed because of your leadership? When you see a certain artifact or a certain thing that's happened or observe a certain event, asking that feedback question. How did that go? What changed because of your leadership in this? And they should be able to answer that. Um, Thinking about respectful environments into. So this is more than just kind of being kind or having good relationships. It really goes back to this culturally responsive practice and equity and access and student dignity and family engagement and all the things that really make safe and supportive environments. And so strong evidence can be a lot of things. They could be around the school community collaboration, around family engagement, around community resource coordination, support for students experiencing homelessness and foster care, poverty, grief, other environmental stressors. A lot of those things relate to social work. Counselors might look like equitable access to the counseling curriculums or programs, responsive services, a lot of the anti-bullying work and student planning, supports that honor student identity and development. In psychologists, that might mean evidence around culturally responsive assessments, attention to disability factors, and recommendations that are individualized and equitable. So again, a very similar standard, but very different evidences in terms of how those roles can work within them. And so really evaluators can't avoid reducing this to just kind of a single event or a single poster or celebration. The stronger evidence really just shows how the practice or how the professional recognized the barrier, adjusted the practice, engaged families and staff, and then improved access and belonging. So again, the standard doesn't change, but the lens, how we want to view that is really important. And then those questions, ask those questions. What barriers did you identify and how did you reduce them? And how did your work contribute to a more inclusive school environment? These are not hard questions. These professionals should be able to answer these questions. If you feel like that you've seen something that wasn't as clear as you would like it to be, or as it makes you confident to rate them a certain way, ask the questions. Um, all right, 3.
So when we get into standard 3, professional practice, I want to say that as evaluators, it's very important that you understand who these people are and what their roles are. Even though they are similar and some things overlap, they are not the same, and we'll get into role distinctions later. But it really will help you as you're evaluating school social workers, school counselors, school psychologists, to understand in the beginning, well before the evaluation, what their roles are and whatever that looks like in your particular district, and having an accurate understanding of the role. Some key words when you look at professional practice would be comprehensive services. What does comprehensive services look like for a school social worker, for a school counselor, for a school psychologist? What is unique to their specialty area? So is it a home to school connection? It is an in-school connection. Is it assessment and psychoeducation? What does communication look like? Those vary and those are different. And what are the different levels of consultation for direct and indirect services? What are the interventions that vary for professional practices throughout these CIS roles? And what is program implementation? Not all of our roles have a standard course of study, and we all have different professional standards that are set by our governing organizations. So what does that look like when it comes to program implementation for a school social worker, for a school counselor, and for a school psychologist? When you understand those things, then that will help you to have a better informed observation that is very evaluator facing, and not evaluating one way for all 3 roles. Possible artifacts, again, for standard 3 are going to vary. Standard 3, some possible artifacts for a school social worker may be looking at what is the emphasis on that connection between homeschool and community. So that may be looking at social histories, family assessments. That may be looking at resource coordination, academic attendance intervention plans, and crisis response. For a school counselor, we have a standard course of study. And so when we look at comprehensive programming, our evaluation or possible artifacts might be around classroom lessons that we deliver, not as teachers, but as school counselors that are for direct instruction. That might be small group delivery that we have. That might be individual student planning around academic, career, or social emotional service delivery, responsive services, student advisement, and anything that deals with post-secondary success. For school psychologists, again, that may look like assessment summaries, that may look like any type of psychoeducational educational delivery that they have as well. The questions that you're going to ask here are, what specialized skill did this require for these particular areas? Why was this intervention selected for the service delivery that they provided? And how did they collaborate? Who did they collaborate with for their professional practice? Was it with one another? Was it with a career development coordinator? Was it with an EC teacher? Was it with the teacher? Was it with a community organization or external partner? And what is the evidence that shows that this was effective? Again, we're all about impact and outcomes. Standard 3 is very important because it is part of the abbreviated cycle for school counselors and for school social workers. So it's very important that, again, you understand the professional practice of all 3 roles by accurately understanding what each role does in your district or your school. And so when we get into standard 4, supporting student learning, we all support student learning, but we do this in a variety of ways. So again, looking at those keywords, what is the student learning? What are we looking for in our schools? What are we looking for students to engage in, to be able to improve in? What are the barriers that we see in our districts, in our schools, that are the barriers to achievement? Are there any type of strength-based services that are taking place that we are involved in? And what interventions are we we using as school counselors, school social workers, and school psychologists to help to address those barriers? What preventive measures are we taking? What are we doing to look at early intervention for things? Are we using things like functional behavior assessments? Are we using BIP plans? Are we using processes like MTSS? Are we working with our school improvement teams? Are we involved in parent-teacher communication and conferences in and out of school? What are our problem-solving methods that we are using to support student learning, whether it's academic, social, emotional, or career support that we're providing? And possible artifacts that you could look at, again, that D word. What are the pre and post data that we are using as school social workers, school counselors, and school psychologists? When we start working with the students, what are the measures of growth from the interventions that we're doing to be able to show our impact? Are we looking at attendance data? And are we seeing those improvement? Behavior data, academic progress data, student support plans, intervention plans, things that we already are doing. If we are facilitating groups as school social workers, school counselors, and school psychologists, what is the impact that our groups that we're having as small groups, whether they are addressing anxiety, attendance, if they are addressing any type of study skill, what is the impact that we're showing on our work? Any type of crisis response documents. Again, we work together, and sometimes it requires for us to go in to deliver as education adjacent partners classroom lessons around bullying, around human trafficking, around suicide, around anxiety, around academic supports, a variety of lessons. So that could be an artifact that shows student support for learning. And then MTSS, a lot of us are engaged in different teams that assess academic and behavior performance of students. MTSS is one. And so there are things that we can show as an artifact of our role in those progress monitoring of the student growth in those behaviors. And so questions that you might want to ask is, what student need or barrier was identified by a school social worker, a school counselor, a school psychologist? We are looking at data. We are not mindlessly doing our work. So we're looking at attendance data. We're looking at behavior data. We're looking at academic achievement data. And we're looking at this data very much on the front end because it really informs the program and the services that we deliver to our students. As Pacovia said earlier, we want our roles to be in alignment with school improvement plans. So we're looking comprehensively at data in our schools that are specific to helping students in small groups and subgroups. And then what was the data need? What was the data theme that was showed as a need that needs to be addressed, and how our specific roles can address those needs that may look differently when we look about the holistic wraparound services. And then with that data, we're able to come up, what intervention or support did your school counselor, did your school social worker, or did your school psychologist provide to really help to address the need of the student at that time, to really show the impact? And how did the support connect to student learning, attendance, behavior, engagement, well-being, etc.?
Standard 5 is reflecting on our practice. And so some of those key words that we see across the 3 areas in our evaluation: reflection, data analysis, professional growth, research-based practice, program evaluation, changing practice based on evidence. So for school social workers, that could include, the reflection might focus on intervention effectiveness, service delivery trends, family engagement outcomes, attendance or crisis response data, resource gaps, and how services were adjusted to better remove barriers. For school counselors, that reflection could focus on counseling program results, student outcome goals, participation, access data, curriculum effectiveness, individual planning outcomes, and closing opportunity gaps. And for school psychologists, that reflection could focus on intervention effectiveness, consultation outcomes, assessment and report writing practices, disproportionality considerations, and database recommendations. So some of those artifacts could even include that self-assessment and professional development plan that we might do at the very beginning of our evaluation process. Could also include student outcome data, program evaluation summaries, where we revised intervention plans based on the data and responding and changing based on data. Documentation of professional learning, and maybe even research articles or guidance that we use to adjust our practice, professional organization membership or leadership. And then some of those feedback questions that you might ask around Standard 5 and reflecting on practice is, what data did you review to evaluate your effectiveness? What did you learn from the data? What changed in your practice as a result of that data? And how did professional development connect to your goals? So before we start to dive in a little bit more specifically to each of the 3 role areas, we wanted to know, which CISP role do you feel like you know the most about? So ranking them, like, I guess first would be the one you know the most about, and last would be the one you know least about. And you can just use acronyms if you don't want to type out the whole title, but who do you feel like you know the most about, and whose role do you feel like you know the least about? So you can put that in the chat. Interesting.
Yeah, these are very interesting.
Yeah. My expectation would kind of be school counselors might be the ones that are most known, because there is usually at least one school counselor in each building, and
Yeah.
social workers and psychologists a lot of times are more itinerant.
It's very refreshing to see that a lot of you all know all 3 roles. So this is very refreshing and pleasant to see.
Yeah, the mix is cool. I guess it probably depends on what your background is.
Yeah, absolutely. I see some school psychologists names I recognize, so I'm glad to know that they know the most about school psychologists as well.
Yeah, yeah. Cool. Awesome.
All
All
right.
right.
So,
Oh, go
So
ahead.
we're going to go into the role specific slides. Just want to make sure that as an evaluator, you understand that the same standard can show up in different ways. So a school social worker, a school counselor, a school psychologist may all support student mental or behavioral well-being, but their evidence, their scope, their tools, their professional decision-making is going to differ somewhat. So school social work, the primary lens is around home, school, community barriers, family systems. Attendance is a big focus, crisis response, conducting social histories, coordinating resources, advocacy, and ecological assessment. School counseling, primary lens is around comprehensive school counseling program, academic or career or social emotional development, providing classroom lessons, advising, responsive services, and data-driven program planning. And school psychology, we're primarily looking at psychoeducational assessments, consultation with staff or parents, MTSS problem solving frameworks, mental and behavioral health supports, evaluation reports, and intervention design and progress monitoring.
All right. So we're going to talk about these roles individually for just a few minutes, starting with school social work. And our primary lens is around that ecological perspective. So that means that social workers are looking at students in context of their home, their school, their community, their family system. All of that context is kind of how we work. A lot of our work may not even be done in your school building. It could very well be done outside with all of these systems in place, and navigating these systems, the community systems, the medical systems, the DSS systems, all of those things at play. So thinking about that, evaluators really don't have to know every single detail of social work practice. They do need to understand how much of that work is about identifying and reducing the barriers that interfere with learning. And so the strongest artifacts really show both the interventions that take place and the outcomes. The thinking about the school improvement plans and aligning that work, because and what makes those work plans strong is that it connects the role of the school social worker to those school goals. And so attendance intervention data is strong when it also shows the baseline, the intervention, the progress monitoring, and the outcomes. De-identified case notes can show kind of that professional reasoning and follow through. Specialized assessments with those social histories and developmental history plans and all those things that go in there, that referral and tracking. I saw someone mention the CISP report earlier. We know that was a pretty massive undertaking for most people. But the data that you get to track and see along the way from that really is telling of stories about how invested these professionals are in the health and wellness and academic success of these students. Thinking about here is around confidentiality, and this is really for all these roles, but I mention it here because I get a lot of questions and concerns about some of the really sensitive information that social workers know and learn about not only students, but their family units as well. And so evaluators can really trust that de-identified artifacts and information is fine, because we really don't want any of these professionals to compromise their student and family privacy to demonstrate their practice. They can do that without divulging information that is not necessary to achieve that goal. Thinking about some of those evaluator questions again, the strengths and needs, these professionals, in particular social workers, should be very well adapted at assessing strengths and needs. They should have a process for doing that. Also thinking about partnerships. That's a very strong, again, social workers are about systems, not just about what is in the classroom, what is in a school building. We thrive in systems work. And so what partnerships are developed? How are you navigating those partnerships and systems? And then again, that impact and outcome questions as well. And so in this abbreviated cycle, again, this doesn't mean a shortcut and we're not going to do all the work. It really just means there's a focus here and we want meaningful evidence. And so thinking about those main questions within these two standards is that leadership. What leadership did the social worker demonstrate? What data did they use? What did they influence the system? Did they support school goals? Did they communicate with stakeholders? All of those pieces can help frame the evidence to answer in that standard 1. And similarly in standard 3, you can see here what social work practice was demonstrated. And that could be a learning opportunity for some of you who felt less familiar with school social work. This is the place where you ask what specialized social work practice was demonstrated here. And again, they should be able to answer that. Role specific services, assessments, again, strong point. We should be very strong at assessments. This set of professionals do a lot of assessing on a lot of things. That's threat assessments, suicide assessments, homelessness assessments. other types of mental health assessments, family assessments, safety assessments, all the assessments. They should be very knowledgeable and skillful at doing that. And then about that improved student and system outcomes. Again, impact. We want to measure impact. We want to evaluate impact. We want to move away from just seeing activities and into how did your practice elevate student learning, or how did your practice improve these student outcomes or system outcomes or school outcomes?
For school counselors, we are in the process of being in our year of full implementation of our new standard course of study. So we adopted our national standards from our ASCA, American School Counselor Association, which is the Student Mindsets and Behaviors or Student Standards. We call them the North Carolina Student Success Standards if you are not familiar with them. And we are in year 3, and this is our year of full implementation. And so a lot of our work that we are leveling up around the state is around our student success standards, similar to other content areas like ELA, math. We have our standards course of study that really guides our work for comprehensive school counseling. And part of those standard course of study comes from a national model framework from our governing organization that helps us with our program delivery. It helps us with access. It helps us with management and really looking at our program. So some of those artifacts that you see here are from that comprehensive lens, an annual administrative conference. If you are an administrator, this is a tool that we are training and really working with school counselors to implement, that opens up dialogue about the work of school counselors and their goals, that is centered around data, their program delivery for the school year. And that usually is recommended to be done within the first 60 days, which is usually around the end of October, to sit down with the administrator so you can understand what it is that they're doing as a school counselor. Stakeholder data, that survey data that your school counselors are using. So school counselors are data-driven stakeholders where they have to use pre and post data to show the effectiveness and impact on anything that they are delivering around our North Carolina student success standards. And those standards really cover academic, social, emotional, and career in 3 areas of learning, social skills, and self-management skills. So anything that we're working around, working with students on is around data that is as assessed as a need for our particular school or within our particular districts. And part of that, when we look at our standard course of study, it is from the lens of small group and whole group lesson planning. When we look at our direct services for school counselors, 80% of our time should be spent in direct and indirect services according to our comprehensive planning. And then there's an advisory council that we, as part of this comprehensive school counseling framework that we use, that engages other stakeholders to learn about our work. And there's a plan that you can see of what it is that we do. Usually this advisory counselor is an interdisciplinary team of people that we invite to learn about our work. And it usually takes place 2 times a year, fall and spring. In the fall, we kind of talk about what the anticipation is. In the spring, we are reporting out data. It is a great artifact for us to show what we have done. Also, there are other things that we are connected to that we're not necessarily written in, but career development plans and the work that school counselors partner with our career development partners can be another artifact that's not listed here, and our engagement with that work, and also other social emotional things. The questions that you really should be asking is what counseling specific skills, services, or interventions were demonstrated. Because we have a standard course of study, there are 36 standards that we that lead our work in working with students in small group and whole group. And what is it that we were addressing? What skill were we trying to teach that we are trying to see if we are being effective and showing impact in regards to student success and outcomes? What evidence shows the impact on the students? So be asking, what's the pre and post? So talk to your school counselors and ask them, hey, after holding this small group, did you see that this intervention was intervention successful, or was it intervention resistant? How did the school counselor use comprehensive school counseling program to respond to identified student needs? So again, we always encourage school counselors to first start with your school improvement plan. What is the direction of the school, and how does your school counseling program align with that? Where can you see your school counseling program fitting into the overall direction of the school based on the school needs? If you're not, if your school doesn't have a school improvement plan, then we encourage them to look at various achievement data. We are now operating in a 5th edition of our national model framework, and school counselors are really looking at what is the impact that we are having and our programs are having on achievement data and those different contributing factors such as attendance, systems, and behavior, etc. And lastly, how did the school counselor use data to select, implement, and evaluate counseling services and interventions? Again, not mindlessly just having a program, but our program should feed into and should be specific to the data needs of our school, whether it's a small group, whether it is a whole group lesson. Anything that we're doing should be data driven. For our abbreviated cycle, based on the field, the standards that were chosen were standards 1 and 3. And so for school counselors, evidence that you should answer is, what is leadership advocacy and collaboration did the school counselor demonstrate? What type of leadership role? Are they leading any type of initiative that helps at the national level, at the state level, at the district level, in their school? What are they advocating for? Are they advocating on behalf of students, families, any type of collaboration with stakeholders? One example of collaboration that you may see taking place with middle and high school counselors are, again, around the career development plans, because it's taking all hands on deck to make sure that we have 100 compliance and implementation of those career development plans. So that would be an example of leadership advocacy and collaboration. How did they use data and stakeholder partnerships and ethical practices to promote, again, equitable access, remove barriers, and support student success? I use the career development plans as an example because in that legislation it says all students. And so when we look at equitable access, removing barriers, how are we making sure that we're working together to make sure all students are experiencing our standard course of study? As school counselors, we are responsible for 3 different areas: academic, social emotional, and career. When it comes to standards 3 in the professional practice, how did the school counselor, again, implement and facilitate a comprehensive school counseling program? That's very important when you think about the role of the school counselor, because they do have a standard course of study. So did they use data? Did they are they using the North Carolina Student Success Standards in their work with students, in their work with school-wide program initiatives? How are they using it to give a comprehensive school counseling program? And is it covering those 3 areas: academic, social emotional, and career? And then lastly, how did they use data to align, again, with those areas to address student needs, school goals, and the North Carolina Student Success Standard Course of Study, which is our North Carolina Student Success Standards?
So looking at schools, the role of school psychologists, one thing I really want to sort of underscore in thinking about how can we evaluate school psychologists, what are some good artifacts, evaluator questions, is remembering that school psychologists and our evaluation tool really supports a comprehensive role. So I know in a lot of occasions and a lot of places, school psychologists are very often in a very evaluation heavy role and don't always get the opportunity to engage in a more comprehensive role, which is really what's kind of prescribed in our standards standards and in our evaluation. So I want to make sure that we're really thinking more broadly about ways that we can evaluate all the roles and all the competencies that school psychologists can and should have. So some of the best practice artifacts, of course, evaluation reports, and that is a big part of all school psychologists' role is performing psychoeducational evaluations. And so while you can't observe a school psychologist assessing a student directly, a much better way to be able to look at that is to read an evaluation report. Because of student confidentiality, that's going to need to be a de-identified evaluation report. But that's one way that you can really start to look at what data was used to inform decisions. And then you can have some questions around how did you decide what assessment to administer? How do you make decisions about that? How do you decide what data to collect? School psychologists are trained to be able to provide individual and group counseling, even though it may not happen very often, but looking for de-identified counseling plans or notes from counseling sessions that school psychologists may be leading. Behavior threat assessment, and the behavior threat assessment legislation does say that school psychologists are supposed to be part of that behavioral threat assessment team whenever possible. So making sure that your school psychologists, for one thing, are trained and are part of your behavioral threat assessment team. And then that's another artifact that you can consider is looking at, again, de-identified behavioral threat assessment notes, safety plans that might have been developed that the school psychologist was a part of that team, behavior intervention plans that school psychologists have developed, academic intervention plans, and that could be through an MTSS teaming structure. And then school psychologists, I mean, if we do anything, we go to a whole lot of meetings and we're on a whole lot of teams. So MTSS teams, school improvement teams, any other school level or district level teams that your school psychologist may be a part of, looking at meeting agendas and meeting minutes and seeing all the different roles that school psychologists can and are engaging in. If your school psychologist has led professional development sessions or even attended professional development sessions, those are some good artifacts that definitely align with the standards and with our evaluation. I really want to emphasize that the evidence definitely needs to go beyond just the number of evaluations completed. I would even say the more evaluations completed, the less likely it is that school psychologists are getting to engage in a comprehensive role. But that high quality evaluation is going to include database decision making, consultation, intervention design, progress monitoring, and really being able to show how psychological services support student learning and systems. So some of the other evaluator questions around those artifacts, what data did you use to inform decisions? How do you decide what data to collect? What assessment to administer? How did those assessment results connect to intervention or connect to recommendations that were made? What consultation changed adult practice? And that might be consultation with school staff, with teachers, with your other CISP colleagues, or with parents. And how did progress monitoring inform those next steps? And just so I can harp on the comprehensive school psychologist role a little bit more, I want to emphasize that school psychologist role should include both exceptional children and regular education services. So one myth that I've heard just kind of out there in the field from different places is that, our school psychologists are paid out of EC funds, so they can only work with students with disabilities. And that's not really the case. If you have some questions around how your funding can and should be used around students with disabilities, I would definitely recommend reaching out to our Office of Exceptional Children to get some clarity around that. But engaging in a comprehensive school psychologist role, which means going beyond educational assessments and IEP meetings, that's the expectation for all school psychologists, regardless of funding source. So if funding source is a barrier, to being able to offer comprehensive school psychological services, then maybe there's some problem solving that can go on around that, or again, maybe just reaching out to the Office of Exceptional Children to get some clarity on how EC funds can be used, and whether that does limit school psychologist's role, because from what I've been told, that should not have any impact on the role of school psychologists as the funding source. But I'll defer to them to be able to really answer those questions. And if you, looking at some comprehensive school psychologist roles and things that maybe they may not be engaging in when you are doing the evaluation, thinking about ways that you can support expanding the school psychologist role to become more comprehensive. A lot of times it's just a matter of not getting the opportunity. And I know that we've got major shortages, and that has a lot to do with what the role looks like in a lot of districts. But offering some opportunities for growth to start to expand into some more comprehensive services. So as administrators, you can try to ensure that your school psychologist has opportunities to serve on like a school level team or district level teams if they haven't already. Supporting professional development to enhance skills that may be lost. So one example of that would be counseling. And that's, again, something that we're trained to do in graduate school, but then we may not really do again once we start getting out in the field. And so you lose those skills. So if there are particular professional development goals that your school psychologist might have around kind of renewing those skills or dusting those off and feeling more competent with those roles, then, making sure that you're supporting their access to professional development around those skills. There can be some ways to limit assessment caseload and then have some problem solving conversations around that. And as school psychologists, if you feel like you are somewhat limited in your role and you would like to expand your role into some more comprehensive areas, using the evaluation tool is a great way to start sort of supporting that advocacy, because again, the evaluation tool is a way to define kind of what that role should look like. And this is the evaluation tool that we've had since 2009. Our standards haven't changed since 2009. And I remember when it came out, there was a lot of pushback from the field about what was included in the standards and in the evaluation, because so many school psychologists felt like, I don't get to do these things and I'm going to be expected to do them. I'm going to be evaluating it on them. But I really think it has helped kind of, again, define that role and expand it and show what school psychologists are trained to do, what we can do, and ways that we can support students in a more prevention intervention rather than waiting for students to become eligible for specially designed instruction. That's my soapbox. So our abbreviated cycle for school psychology, again, we have standards 1 and 2 based on the team that I got together, and we looked at how we could best do an abbreviated cycle for school psychologists. So standard 1, which is school psychologists demonstrate leadership, that can include supporting other school psychologists, mentoring, working within professional organizations to enhance the profession. And so you can look at evidence to answer questions like, how has the school psychologist demonstrated leadership, including across systems levels? How have they supported school and district level teams? How have they maintained current knowledge of school psychological practices and advocated for policies and interventions to support students, families, and schools? And standard 2 is school psychologists promote a respectful environment for diverse populations. And because school psychologists are very knowledgeable about different types of disabilities, that diverse population a lot of times includes the needs of students with different types of disabilities, and having a good understanding of that. But also has the school psychologist demonstrated knowledge of the learning and social needs of students and families with different language and cultural backgrounds as well. There's lots of different ways that school psychologists work with students to promote a respectful environment for diverse populations.
All right, so some observation possibilities. This is just some practical information. for the evaluators. Again, not every evaluation observation has to be a confidential individual session. Really, for most CIS roles, some of the best evidence comes from some of this team-based and systems level practice work. So you can have some direct service opportunities, which might be individual sessions, group interventions, classroom lessons, student check-ins, crisis response, and follow-ups. Um, all of those pieces. But it also could be some of that systems work, program planning, data review, professional development, teacher consultations. That's a huge one in all of our fields. We are frequently doing consultations with teachers and other school staff around different things with students and staff and communities. Those community partnerships and protocol developments. It's really just the evaluator's job to identify an authentic observation opportunity that aligns with the role and protects confidentiality. And so that might require a little bit of planning because we also know that some of these positions are shared among a lot of different buildings. And that makes it a little harder at times. So planning could be more necessary for some of you more than others, but definitely thinking about that. Um, let's see. Well, yeah, we'll go ahead here and then.
Okay. So you've heard from us and our the variation in our roles and our service delivery with students. So now we want to give you a scenario case study of one student but three different role lenses and how we would work with this student for our wraparound services. So in this scenario, you have a seventh grade student, which I love because I was a middle school counselor for most of my career, who has been experiencing increasing absences, declining grades, having some peer conflict. Um, Sounds very familiar to middle school, and recent anxiety symptoms. Their caregiver is reporting some transportation instability and difficulty connecting with services. When you think about a school social worker with that home to school community connection, they deal a lot with the family system barriers, academic interventions, resources, and home to school communication, that whole ecological assessment. The school counselor, who is mainly in the building, deals a lot with the student planning. So they're, again, the academic, social emotional, and career holistic program service delivery. So that might look like small group or brief responsive services, academic support if there's some academic barriers. The school psychologist may be looking at data review, consultation, screening assessment, intervention, and progress monitoring. Megan has given you expanding that. They also could be helping and partnering with the small groups if needed as a comprehensive stakeholder. So in the chat, we want you to put what evidence would you expect to see from each role if this case appeared in an evaluation conference, if you were evaluation facing. So what would that look like? Similar with collaboration and student-centered supports, data, family, staff engagement, but different from a professional lens. So what type of artifacts would you see from a school social worker? Would you look for from a school counselor or from a school psychologist? If you would put that in the chat, take a few minutes to think about that. And what would that look like? One student, but three different roles and how they work with this particular student.
Or you can just choose one of the roles. We said each role, but that's a lot to put all three. But if you want to choose one, or if you want to choose all three.
With what you've learned today, And as an evaluator, what type of artifacts would you look for from your SIS stakeholders for this middle school student? Anxiety support plan. Okay, thank you, Dara. And who would that come from, Dara? Would that come from the school social worker, school counselor, school psychologist? Who would you be looking from that from? We had a few ones to open up in the beginning that said that they were very confident in working with doing evaluation. So we'd love to hear from you all. What type of artifacts? Counselor or psychologist, thank you for sharing. School counselor includes student response. Okay, thank you, Christy. Data trackers, comprehensive school counseling plans, alignment data to the CISP. So with this middle school student, looking at the data, if there's an attendance goal, and if this student were to fit into an attendance goal for that subgroup of 7th grade students, perhaps in a building, if there's a goal around grades that this 7th grade student fits into, then you might look at some of the small group or some of the intervention planning that a school social worker, a school counselor, or a school psychologist is doing to work with that aligns with the attendance goal or the declining grades that may already be into a SIP plan. So this student may fit into already a data need for your school. So when we talk about anxiety symptoms, this student may be pulled to be a part of an anxiety group that one of these 3 roles may be facilitating, or they may be working with, if transportation is a barrier, then you may be looking for something that the school social worker has worked with that family to secure services.
These are good. Student success plans, that's important. Yeah.
Very good. So as evaluators, it's very important as you are doing the evaluations, as you can see, we all are part of the number 1 for the abbreviated evaluations, but they vary for school social workers and school counselors. We are standard 3, and then school psychologists are standard 2. And so when you're looking at the evaluations and the observations, what does it look like for that particular role when they're working with, we all may be working with one student, but how we work in our artifacts may look different for that same student based on our engagement and our service delivery with that student. So thank you all for your feedback for this scenario.
Awesome. So as we wind down here, we're going to explore some of these common errors a little bit. And these are the big 3. There's a couple honorable mentions, but these are the big three, very common. And if we can name them, then we can avoid them. The first is this volume bias. This large number of activities doesn't automatically equal an accomplished or distinguished. We're not really rating the busyness of these professionals. We're rating their practice against rubric language and the evidence of impact, which we keep saying because it's that important. And we realize these individuals are busy. I've said that at least the psychologists and social workers are often shared. There's some counselors who might be shared, though it's more rare. But these individuals are among different places. So of course they're busy. Of course they can have a large number of activities, but you really want to ensure that as you are evaluating and asking those questions, is the practice that they are busy with aligning with the rubric and the language, and is there an evidence of impact? So again, activities in large numbers and busyness does not automatically equal an accomplished or distinguished. It might if the other things align, but it does not have to be. And then role confusion. This is a big one. Of course, this will not look at all like classroom instruction. And it won't look the same from social worker, counselor, and psychologist, even one to another. Because as you've just saw, there's different responsibilities and different lenses that we work through, and scopes of work varies. It might not even look the same from one place to another. And I'll add this here, that I often get a lot of questions about you all being an evaluator for a social worker who shares, let's say, 4 other schools and buildings, but you're the primary evaluator. And so it might be hard to determine if the full scope of the evaluations and standards are really being met, because maybe the primary focus in your building is on one particular thing, and that social worker spends a lot of time in that one area, but they may spend a lot of time not doing any of that work in their next building, and may have a totally different focus. So being sure that there's at least some level of collaboration, and that can be the social worker showing those evidences across the different buildings that they work in, or that can be outreach amongst each other as evaluators to say, hey, I'm working on this. I got a little hung up here. I'm just trying to make sure that these things happen, or I feel very strongly that this happens, and I want to be sure that you're aligned with that, you're okay with that. Just remembering that collaboration, or ensuring that we don't rate down because it's something you don't see in your building, but that social worker or psychologist is fulfilling those parts of the standards and evaluation in other buildings.
Jacoby, and oh, sorry.
Yeah, go ahead.
I was for school counselors also, do not evaluate them if they are being inappropriately utilized in a school. For example, for elementary school counselor who should not be in rotation but is being utilized as a specialist teacher, they are not a teacher, and so your evaluation should not be around them teaching. And that is an inappropriate role. Or if they are utilized as a 504 coordinator, using a 504 meeting to do their utilize as their evaluation moment. So when it comes to that classroom instruction piece, they are not in your districts as teachers, they are in your districts as school counselors. So making sure that their evaluation opportunities come from opportunities that are true to the essence of school counseling, and not to inappropriate ways that they are operating in your school or your district. So again, going back to understanding each role and how they should be operating, and not evaluating them wrongly, that's misaligned with their role. Thank you, Pacovia.
Mhm. And then that last one, there's just that artifact dump. So you have assists come in and just has a folder notebook full of documents. But that they're not connecting. And so that doesn't automatically mean there's strong evidence. Artifacts need explanation. And if they're not well explained within their portfolio, then you do have to ask those questions to connect the artifact to the standard, the student, or the system, and that professional action and outcome. And so just being sure that just because they come in with a whole portfolio of things and dump them down without an explanation and those connections, that doesn't automatically mean that that's strong evidence. And that, again, that's a little different from the first one in being busy and having a lot of activities. This is about having actual artifacts and proof, but whether or not that proof is strong evidence or not. And so an example around here might be a social worker has, 10 pages of contact logs. Well, that's great, but without explanation, that just feels like volume and not a whole lot of impact. So if they then explain that the contacts were part of a structured attendance intervention, and then connects them to some baseline data, shows that collaboration with families and maybe transportation systems, and then provides some outcome data, then that evidence really becomes meaningful and strong. Strong evaluation requires interpretation. And those clarifying questions is important rather than just guessing what an artifact might mean. All right.
So we just want to kind of wrap up with the idea that accurate evaluation strengthens practice. So if the evaluator is really well informed about what the CISP role should look like, ways that you can collect artifacts, and what questions you can ask, you're going to be giving that professional a more accurate evaluation. And as a professional being evaluated, if you know that somebody's going to be asking you questions about why you made certain decisions, or you're going to need to reflect on your practice and collect some data about outcomes. If you know you're going to be asked about that, you're going to be more intentional about making sure you do that. And that's something that can be kind of easy to let go, in the midst of everything else that's going on. So the purpose really of the evaluation is to strengthen our practice, and for us as practitioners to become as effective as we can be. So making sure that we're using the rubric language in every observation and summary conference, asking for that evidence of impact, not just evidence of activity. And we've talked a lot about that, just what those artifacts can look like, and having context for the artifacts, and having a lot more conversation around how did you make this decision? Why did you choose this particular intervention? What was the impact of this particular artifact? Respecting role-specific scope and professional standards. Using that abbreviated cycle appropriately and intentionally. And I think especially for places where you are evaluating a lot of CIS professionals, having that opportunity to use the abbreviated cycle is going to be a big relief. Also calibrating with other evaluators. So if you are a principal who's evaluating a school psychologist who also works at another school, maybe as two principals who are evaluating that school psychologist, you could kind of calibrate and look at, well, this is how I would rate this particular artifact or this particular observation. These are some of the questions. How would you rate this? And just sort of making sure that we've got some reliability and consistency in how we're evaluating a CIS professional. So we've got a list of resources here from our different fields, and you should be able to click on any of these links and get to the different resources that we've got here. And I don't know if either Pacovia or Keisha want to say anything about the resources that they added, but I put on the professional school psychologist standards, which is in that document. It's a long document, but pages 4 through 25 just really outlines those professional standards for school psychologists. And also our national standards, our NASP 2020 practice model. There's a link to that as well. And you can see a lot of connection between our state standards and our national practice model.
Yeah, I just have there kind of a cheat sheet for evaluators around the observation and evaluation questions that can happen. And that's broken down by standard. So it's a nice way to see it all on one sheet to help with guiding that observation and asking better questions.
I just have something that's been in existence for a while, just a post-observation and summative evaluation questions, and then also just a sample evaluation tool for school principals of what to look for school counselors that we adapted from a district from Cumberland County Schools that might be helpful as well.
We'll hand this back over to Jennifer.
Okay. These ladies did such a good job in informing all of us what these observations can and should look like, and being able to have those really in-depth conversations with our professionals so that we can observe them fairly and give that feedback to help them to grow. And in that light, we also ask for feedback when we finish our webinars, because we do look at this feedback, and using this, we use it to develop the next set of sessions that we offer. So please, if you have some time today, give these ladies some feedback on this form. It helps us to grow, and it helps us to get better and to give you the services and the training that you need to help you to be better observers for these roles. I also wanted to share with you, as they said, they're doing this for the observers today. They're also going in September to be doing webinars geared specifically to each one of those roles, the social worker, the counselor, the psychologist, and we also are going to offer the teacher leadership specialist and the CDC coordinators. So if you are interested in that, if you would like, I will add it onto the slide deck so that you can go to the website and you can see our training opportunities. But please pass this out and encourage everybody in your district to attend, because if all of us are hearing the same thing, our observations are going to get even stronger, which is going to strengthen practice within our schools, and it's going to help our kids to perform better. So thank you so much for coming today. Please do give us feedback. We do appreciate it. Now I'm going to open it up to these ladies to answer any questions that you might have. If you can answer, we can turn off your silent and let you raise your hands, and you can ask any questions that you might have or put them in the chat. Thank y'all so much.